Hello friends, how are you? Hope you are able to understand a few nitty-gritties of this Peyronie's disease. Okay, you can understand that though you may not heard of this disease at all, that maybe that you have some problem which mimics this Peyronie's disease. I can tell you, can bet that there are many of you who will be suffering from this disease, and these are mainly in the 40 to 50 years age group, because as you can understand, there is a early part. Okay, the early part that we tend to neglect. So it's been happening from 35 years, 34 years. Whether erectile dysfunction is the cause of it or whether it causes erectile dysfunction, nobody knows. But there is a close association with erectile dysfunction. Okay, so we have this soft having sex with soft penis, and happens, minor traumas. Okay, being and happens and culminates into this process. So at least 5 years has gone of this whole the early part, the where you could have done this primary prevention of this problem. So after that it happens. So it's mostly the 40 to 50, because these are more sexually active. After 55, people are not that sexually active. So it's 40 to 50 age group people, individuals who are more being affected by this problem. And now they're coming, they're feeling that they need to talk to the doctor, because the biggest thing I told you, the biggest thing that is happening, that they feel that there is something abnormal in the penis, and then when they get scared, maybe it's a tumor, then they seek medical help. But by my intention with this course is to make you understand, whenever you have this clinical problems, before anything structurally abnormal happens, then if you can come, no, then we can give some amount of reassurance, or some remedies. Otherwise, if the plaque happens, nobody can help you. Even the surgical treatment, where there is a plaque excision being removed, it's also a very disfiguring surgery, and it does not guarantee you that you will have a normal sexual life and that you have a totally normal life that you has to had to before. That is the problem. No, no, what is the cause? You can ask me, Dr. Sir, what is the cause of this problem? The cause may be multiple, but as I said, one of the very important causes is multiple, intermittent, repeated, minor sexual trauma. Okay, especially with soft penis, whatever, and then that injury is happening over the pubic bone. The penis is getting striking against the penis, the hitting against the pubic bone, or so whenever this happens, now the whole thing, the whole cycle happens. So there is a curved penis, again doesn't go in properly, again it hits, again the more, this is a vicious cycle form of thing, right? And second, so there's a lot of being this clots being formed and fibrosis being formed inside this tunic albumin, as I showed you in the anatomical lecture very well. Okay, and then this becomes inelastic. Another thing, maybe they have been said that many people are actually do not have any history of sex. Okay, they're just masturbating, nothing else, because it doesn't happen with masturbation. Okay, so forced masturbation, I don't think it doesn't ever happen. It only happens with forced with sexual intercourse. So it is said that it may happen with vitamin E deficiency. It can happen with people using beta blockers. They can have a genetic etiology. These are all being theoreticals being put around. And some people have said, because it's an association with erectile dysfunction, there may be association with the syndrome X I told you about, no? Type 2 diabetes mellitus, hypertriglyceridemia, cholesterol issues, and cardiovascular issues. It can have a binding, obesity. So this can have, but how much it is totally relevant to the Peyronie's disease production per se, I don't know. It's all been be part of the erectile dysfunction, all this being a constellation of sciences symptoms that come together. It's an iceberg comes, the tip of the iceberg concept that is happening in the male individuals today. So these are the few things that I need to discuss. Another thing is, what are the clinical features I've told you. The patient comes mainly with that plaque, okay, and the induration and that curvature of the penis, which is just debilitating. Now, the patient can have severe pain while having penis or having sex, and also the erectile dysfunction, which becomes a perennial problem. So once the disease has progressed to some state, I don't think any form of medical treatment, because we do give vitamin E supplements, but when the disease has progressed, not much can be done, because some people have tried even injection, putting an corticosteroid injection, but any form of trauma, it also incites more inflammation, pro-inflammatory process, and more fibrosis. So it doesn't really happen. So you can go for surgeries, and but again, it's not much of value. So ultimately, I want to say that the disease has two processes. The early acute phase, when the patient has severe pain. Pain is the most important. There will be some amount of curvature, and the patient has erectile dysfunction because he's having severe pain. He can perform sex. Whenever his penis become rigid, that's a very, even if he is not having sex, even in the morning, two missions happens. Even the penis become rigid, he's having pain. Then it comes the chronic phase after say about 2 years. He's suffering from 1.5 and 2 years. Then he goes to the chronic phase. Huh? And the chronic phase, the disease becomes stable, stabilized in this fashion. So this doesn't have any pain. The pain part is gone. Curvature is becoming too much. The plaque or the indudation of the nodule is becoming prominent, and the patient has erectile dysfunction. Erectile dysfunction is not, there is no pain while having sex, but has severe erectile dysfunction. I told you them in the cause of erectile dysfunction. There can be vascular cause, or the veins are not, there may be a venous leak, or the blood is not going in because of the fibrous plaque. Now the blood is not allowing the blood flow, the arteries to give more blood beyond the plaque, beyond the fibrosis. Okay, and maybe that the rigidity is not happening to that extent. Okay, and how much of it is associated with uh, the testosterone being down previously, and the person is having erectile dysfunction, having a they're not having the sexual drive, low libido, is also a point of conjecture. So this is all, this is, as you can understand, it's a very complicated issue, but I've tried to make it very simple. If you find it very complicated, please go back again, go back again, and I will be summing up the thing, and what else can we do, what else can we do in the final parting comments. Okay, so so that's it. It's very important that even if you are not having this disease, please spread the word among your friends and family members who may have been suffering from the disease. Okay, I can understand it's not an issue that we tell everybody about. We will discuss all this about, and many of us will be very reluctant in commenting, because we feel it's a very private issue, isn't it? Very private, very so the privacy is a important thing, and that is only because of this that we get embarrassed and we don't come to the expert help early. And all these diseases we are talking about, all this is, we, even when the scrotal pain we talked about, all this is, when we don't come early, we don't that is the concept of the primary prevention. When we are not able to strike hard, strike in the first instance, the disease affects our body, then the golden period is lost. Then we are basically in the complication stage. The time period it gives for effective cure is very short, and we don't realize that basically we are suffering from the disease. That is more of a problem. Okay, so that's all for today. I'm just in the parting comment, the final module. I will be telling a bit of bits and pieces of how can we, in fact, help ourselves if we are suffering from the disease. Okay.